I'm Nancy Eigelmiller, and I'm the Executive Director of 1 in 5. I started 1 in 5 after losing my husband to suicide in 2008. And I took about 2 years just to really figure out what was going on in this space. And what I found out was that mental illness starts very young and that there was very little education that was happening in schools. So I decided to make that our priority. 1 in 5 really works to normalize the conversation around mental health. And so we work a lot in schools putting mental health education into place. And then we also work out in the community to educate about prevention methods and teaching people tools to deal with their mental health. So the programming that 1 in 5 is doing with schools is in the prevention space. We're educating both students, staff, and parents about tools to deal with mental health, signs and symptoms, how to recognize what the resources are, how to have a conversation around mental health. Right now, the average amount of time that it takes a child to get service is 8 to 10 years from the onset of symptoms. And that's really unacceptable. And over the last couple of years, really the impact that it's having with staff. Staff has been very stressed over the last couple of years, and this programming is people just rave about it. It gives them tools to help them really take care of themselves. To get involved, we would recommend that you send us an email at info@oneinfive.org. We have a lot of volunteers that work with us. We also just opening doors to sponsorships or to schools that we're not working with is extremely helpful for us.